If you own a cat, then please watch this video because I am spreading awareness about a life-threatening medical emergency that can commonly affect cats, more specifically male cats. However, it can still affect female cats in rarer situations. I'm talking about feline urinary obstruction, also known as urinary tract obstruction or blocked bladder. And this is where a cat's urethra, which is the tiny little tube that transports urine from the bladder to the outside, becomes blocked. Now, male cats are more prone to getting urethral obstruction because of their anatomy. They have a much longer and a much more narrow urethra compared to the females who have a shorter and a wider urethra. Therefore, males are more prone to getting it blocked. However, it can still happen to females in rarer situations. And a urinary tract obstruction in either male or female cats is a medical emergency. It is a life-threatening emergency, and you need to get your cat to the vet as soon as possible. Not later this afternoon, not tomorrow, now. So blocked bladder can be caused by stress, crystals, mucus, inflammation, infection, urinary stones, urethral spasms, or it can just be idiopathic, meaning we don't actually understand what's causing it. And this basically obstructs your cat's urethra, making it impossible for them to urinate. And unless this blockage is quickly treated at the vet, it can lead to life-threatening consequences. And I am talking kidney failure, bladder rupture, elevated levels of potassium in the blood that can lead to heart arrhythmias and cardiac arrest and even death. So symptoms that your cat's got a blocked bladder might be that they're making frequent visits to the litter tray, yet they're not able to pass anything. They're repeatedly straining, trying to go, but they're not passing any urine, or perhaps they're just passing a few drops of blood-stained urine. They might be trying to pee outside of the litter box and going in strange places in the house. They might be repeatedly licking their genital area. They might come across quite hunched and tense because it's a very painful condition. They might be walking around the house and they are crying or they're yowling very, very loudly. There can be a change in their behavior because, again, this is a really painful condition. Sometimes cats can become quite aggressive when they're handled due to this. They can become quite lethargic, they can become inappetent, and they can vomit. So diagnosis and treatment at the vets generally includes a physical exam, imaging, general anaesthetic, placement of a urethral catheter to unblock that bladder. There'll be bloods, urinalysis, IVFT fluid therapy. There'll be hospitalisation, stabilisation, pain relief, urethral relaxants, and intense monitoring because, like I said earlier, this is a life-threatening condition, so often cats are kept in hospital for a couple of days if they have blocked bladder. Early diagnosis and treatment is essential for a positive outcome, so please, if you notice any of the signs of blocked bladder in your cat, please get them to the vets as soon as possible, and don't forget to repost and share this video so that we can educate and spread awareness about this to more cat owners.